Hello my friends from Russia. I'm here recording a special video for you. I'm here at Clínica Miyake in front of the Claques Around the World map, where you can see that of course Claques started here at Clínica Miyake, but first many Brazilians started to train with me, and then also in North America, even Africa or Australia and Russia we have here, St. Petersburg. And I've been teaching Claques around the world, and Claques started here at Clínica Miyake in my PhD, where I studied the temperature variation as a predictive factor for skin damage. That was my PhD from 1995 to 1999 in the best university of Latin America, South America as well. It's called University of São Paulo, where I studied my whole life. And from this study, I noticed that the laser could make some damage on the vein, but many times if you increase the energy, you burn the skin. Then, as my father taught me to use only dextrose 75%, because when dextrose 75% is not alone, without the laser, is not treating a simple telangiectasia, it means that there is a feeder vein, and therefore it's not a simple telangiectasia. It is a complex telangiectasia where you have many, like a spider vein and a feeder vein, and this feeder vein needs to be treated as well. Well, my father taught me, Kazu, if the vein is not responding to dextrose 75%, it means that you have to make a phlebectomy and remove that tiny vein with less than 1 millimeter, sometimes with a crochet hook, very delicate phlebectomy. And I was doing that, and his studies showed that this is very effective, and you give a perfect result with no pigmentation, tiny incisions of 1 millimeter, and a tiny crochet hook is a Japanese hook. And this is very demanding a lot of time and a lot of craftsmanship to achieve the result. Well, my father taught me that, Kazu, dextrose 75% is the safest product, and use only that. If you don't have result, search for the feeder vein, and I was doing that. But when I started to study the transdermal laser, I noticed that the transdermal laser could also damage the vein, and then I thought, why not synergizing both? And that's how in around 1995 to 1999 the Claques technique was born. And then I was damaging the vein, as I say, cooking the vein, and then as the vein is already damaged, I go with the dextrose 75%, and there is a big synergy because the vein is already damaged after I perform the laser. The vein is damaged, and then the dextrose 75% goes there, and you have less volume because of the edema on the wall, vein wall, and damage of the elastic fiber and damage of the endothelium. You have to use less. You can't inject much more because the vein is already with the internal diameter is smaller, and that's the beauty of Claques. You really don't need anything more than dextrose 50%. And in India, for instance, Dr. Ashish Dadas, which they made a certification with me years ago, he doesn't have dextrose 75% there in India. Then he uses dextrose 50. I told him, use dextrose 50%, and his results are amazing as well. That means you can't synergize with detergents, because detergents, they are more aggressive, and they not only can give pigmentation, skin ulcer, but also, it is rare but happens, death. It is true. It happens, and those cases are not published. You may have an anaphylactic shock. Even, of course, some doctors, they are treating for 10 to 20 years without any complication, any anaphylaxis, but it may happen. We don't know exactly how much is the probability, but it happens. And can you imagine someone going to treat a tiny telangiectasia and then dying in front one case in India, not from Ashish, another doctor, famous doctor, the son asked the mother, asked the doctor after the 3 sessions, successful sessions of foam, I believe, and detergent. He said, as the result is so amazing, can you treat this little vein? And the doctor injected. The mother had an anaphylactic shock and died in front of her son. That happened, and it's not published. It was only among the vascular surgeons that this doctor shared his tragedy. Anyway, that's why that Clark's technique should be performed with dextrose 50%. And dextrose 50% is everywhere because it's a product that we inject. It's an organic product. We have this dextrose inside of our body, and it's only because it's concentrated. And because of the concentration, by osmosis will take the water from the cell and will kill the cell, will dry the cell. And that's the beauty of this synergy from transdermal laser and dextrose. As I went to more than 20 countries, spreading out the Clark's technique, even in St. Petersburg once. Sometimes I travel far away, but I have only 10 minutes to explain. Or in St. Petersburg it was 1 hour, but it's rare to have more than that. And what happens? The doctor will watch and will start performing. Not all the doctors can come here to practice and to stay a week here having the certification. It is ideal. The doctors that did, by the way, the doctors that came here and spent a week, I changed his life or her life for much better, and of course the patients, of course, as well, because we really can. It's not only the Clark's technique, it's the Clark's method, the Clark's approach, the perfect premium technology technique to commit to the result, taking pictures, sometimes 100 pictures that I have on the computer before the treatment, with and without the vein viewer, and so that the patient understands that I'm committed to solve the problem, to find the feeder veins. And with Clark's technique, I can reduce 86% of phlebectomies. But you can't do Clark's for everything. There is a protocol. You can't, if you perform Clark's on veins that are bigger than 1.5 millimeter in diameter, in the internal diameter, measuring on the ultrasound, on the standard position, you have above 1.5 millimeter, you start to have more pigmentation, and you have failure as well. And these situations, I prefer to perform phlebectomy, and if the vein is deeper, of course, endovenous laser is the perfect tool. Well, this video is special for you, doctors from Russia, and I believe Russia is the country that I have more followers performing Clark's technique. I'm really proud of that. And of course, here is summer, it's always warm. Russia is really cold, but women from Brazil and Russia have something in common, because they like to take care of themselves. They like to show their legs, to put a shorts, even though it's cold. They like to put a mini skirt, or to walk on the street with showing her legs. And that means they value their legs. And for that, you will need the Clark's technique. Well, I'm here in São Paulo. We organize courses. I organize also twice a year workshop in Belgrade, which is very much closer for you in Russia. And I'm recording this video to share that Clark's technique is a wonderful technique with more than 20 years of development and testing and science here at Clínica Miyake. Of course, there are doctors changing a little bit, and I've seen many complications because of that, and I'm afraid that the name Clark's would be not giving the correct result, and that's why I give certifications and trainings, and I'm I'm also focused to improve this even more to help you achieve this result, which is fantastic. Now we have since last year, since two years ago, I started to use a laser, which is a much more powerful laser with optic fiber, and the machine is capable of delivering. The machine from 2 years ago is capable of delivering 2 shots per second, 2 hertz. And this machine that I'm using now, the Derma V from Lutronic, is capable of four shots per second, and the spot size is bigger. I never use, by the way, small spot size. Don't use that. The minimum that you should use is 6 millimeters and 1064 long pulse. I also seen people doing Klax technique with lasers that are not 1064 long pulse and big spot size. That's not Klax, and that will burn the skin easily. Well, with the Klax technique, I'm really happy. These new lasers now, we have even better result with this big spot size, faster laser, and the shot is not 15 millisecond shots anymore. Are multiple shots in 15 milliseconds from it's a milli shot. It's different. I cannot explain here everything, but it's not the purpose of this video. But it's really game changing. It's a new result that we are achieving with this Klax technique, and I've just completed 1 year with this new tool, and it's faster. The patients are happier, as we have less bruising, faster results. Is incredible. One thing that I want to say as well about the vein viewer. I've been luckily the first doctor in the world to use augmented reality in medicine, and this vein viewer was developed to get blood access, vein access on the arms for nurses. And I contacted the inventor, Professor Zeman, in Memphis in 2004, and I convinced him that his device was perfect for finding the feeder vein. Well, then, long story short, he brought the vein viewer to Brazil, the prototype, which is here, and we did the first study of augmented reality in the world in medicine here at Clínica Miyake, and really changed a lot the phlebology. It's a milestone phlebology before vein viewer and after vein viewer, like ultrasound before and after, like orthopedics before X-ray and after X-ray, like many situations in medicine that you have a milestone and before and after. Vein viewer is one of them, Klax is one of them, endovenous laser is one of them, ultrasound, duplex ultrasound is one of them. And I highly recommend you as well to take a lot of pictures before treating, and of course coming here to perform, organizing a course that I could go and train a lot of doctors. Klax is really safe, is the best technique that